Welcome to A Balanced Life on the Go. I'm Dr. Nicole Lindsey, your host on this podcast, along with Dr. Bryan Gennett. This is a podcast designed to help connect you to a more balanced life on the go. Each week, we will bring you simple, concise, and easy to implement ideas, tips, and strategies to help you connect to better nutrition, movement, and thinking so you can achieve balance in your busy life. Isn't this what life is all about? Trying to achieve balance so that we can be healthy, happy, and live to our fullest potential. We're glad you joined us. Let's get started. Hi, this is Dr. Nicole Lindsey.
I'm Dr. Bryan Gennett.
And this is Balanced Life on the Go, podcast number 3. So we have heat.
We have electrical muscle stimulation.
We have cervical extension traction.
We have intersegmental traction.
We have wobble chairs.
We have our pre-core stretch machine.
We have lumbar and cervical disc decompression therapy.
Love it. It's a lifesaver. We also have dry needling on top of that.
And laser soon.
Very soon. That's exciting. And we have Graston or other soft tissue techniques.
Soft tissue techniques. So why, oh why? We do more as well, but that's just some of them. Why, oh why do we need all of these therapies?
We need all of these therapies because all of these, when you put them together in conjunction with each other, you are giving a prescription for the best possible outcomes for you guys, for our patients, for the people that come in here and that see us. Listen, the one thing we didn't mention was chiropractic because
we mentioned that last time.
We did mention that last time. But we are chiropractors, and what we do is chiropractic, and we perform with our hands, right? We do the adjustment, we do the manual treating, and that works, right?
Yep.
But it works varying degrees. Some patients respond faster, some patients respond slower, but it works, which is really cool. We do all of these other things to help increase your chances of getting better faster, of getting stronger faster, and of getting back to doing your goals, what it is that you do, what drives you, what motivates you back in life.
Right. So what you're saying is we don't do therapies in place of the adjustment. We do them along with.
Absolutely.
I was getting worried there for a second.
Oh, no. Nothing could ever replace the adjustment.
Absolutely. So let's take our listeners through the different phases of care and how a patient may come in. Now, everybody's different and different reasons. People come in for different reasons, I should say. But let's take the patient with back pain or neck pain. They just injure themselves, they hurt themselves picking something up, shoveling snow. What are we going to do in that first phase of care?
That first phase of care is so crucial to healing, right? That first phase of care, those patients come in here and they are in pain, and all they want is to get out of pain. And so we do these other therapies just to help modulate that pain. The heat, really good for pushing out inflammation, really good for relaxing the muscles and the other soft tissues. The E-stem is really good to also help breaking up those muscle spasms, also helps push out inflammation. But what it also does is it also stops those pain signals from getting to the brain.
Yeah, we call it the feel-good stuff.
It's the feel-good stuff.
Yeah, it's really cool how that works. It stops the pain. It's a great way to help the person's body relax so that when they get adjusted, we can actually get movement. We can get the bones to move and get the pressure off the nerves.
Which is ultimately the most important thing that we do, right? As chiropractors, we can directly influence the nervous system, and we can actually directly influence the way that your brain perceives pain, which is so cool because if we can adjust you and take that pain away, that's the biggest thing.
Absolutely.
But that works on such an internal level. The heat and stem work on an external level. And that plays a part into it. That plays a part into it as well. That's so important.
Yeah, and in that beginning phase too, oftentimes we have some disc involvement, right? We have a disc maybe injured, maybe bulging to one side, maybe compressed from years and years of walking in this universe with, or on this planet, I should say, with gravity forcing down. So one of the therapies that we have you do is intersegmental traction. That helps to, just like it says, intersegmentally traction out every single segment of the spine from top to bottom. And that helps open up the spine.
Just space, yeah.
The space allows nutrition, fresh blood and oxygen to get in, and the waste material to flush out.
Which is so important. Without fresh oxygen or fresh blood to bring the nutrients, it's just like a plant. Without water, without sunlight, it's going to die without that nutrients.
Yeah, absolutely. And oftentimes people will be on that therapy before their adjustment, and they'll say, I felt pain right away when I got on there as it was tractioning out, but as it continued, I felt releases. So that oftentimes will help us. It'll help get the body relaxed and help make some movement in the spine before the patient even gets to us.
Absolutely. So what do we do after we get done with that feel-good phase? Right, so you're not having as much pain anymore. Your pain is coming down. Your movement, is coming around, but you still feel like you're stuck. You still feel like there's more left in the tank in terms of getting better.
Trigger point therapy.
Trigger point therapy.
We are good at that too. We are known. Elbows, thumbs, yes. So most of the time, the problem with lack of movement is because of scar tissue, because of injury after injury after injury, and your body just tries to repair to help you all the time, but it does so with this fibrotic tissue, which is what we call scar tissue. So in order for us to get movement in your body, in your spine, and to really make correction, we have to break that up along the way, from phase one all the way through your care.
Yeah. So I'm a big Marvel superhero movie fan, and the one analogy that I use to describe what scar tissue is, say if you have like nice straight lines or like nice straight like steel beams that are in buildings, right? That's muscle tissue, and we love that. That's super strong, right?
Yeah.
So going back to Marvel, Spider-Man, if you ever watch a Spider-Man movie and he slings that web and it kind of disperses, looks like a spider web, that's what scar tissue is. Now, you take that and you put it over a damaged steel beam, it's not going to be as strong because you got all these fibers running in different directions. There's no stability there.
Exactly. So we perform trigger point therapy. We're known for this, very hands-on. We break it up. We can do that with our hands. We can do it with instruments.
We can help do it with needles, with dry needling.
Dry needling, that's what that's for. It's actually a needle that goes into the muscle, a very small needle, like an acupuncture needle, and it threads that trigger point, and you can feel the trigger point actually just melt, release.
James did it. Our physical therapist, James, did it on my shoulder 2 days ago, and I still feel amazing from it.
Yeah, he's been complaining he needs the other one.
I know, I told him, you did my right side, my left side's feeling neglected. I'm like, James.
We got to get that done today. Yeah. So that's phase one. So after we get the scar tissue broken up, we've dealt with the inflammation, we're getting you out of pain. Now we move into the next phase, which is
more active therapy.
Yes, and it's about taking that tissue that we now broke up, that spider web, and lining it up the right way.
So one of the first things that we have you do in this active phase, because that's what research tells us. When you're in this acute pain, we do a lot of passive therapies, and that helps relieve some of the pain. But that only goes so far. We need to take it a step further and have you, the patient, do something. You, the patient, kind of take hold and take responsibility for that as well. So one of the things that we do is our Pedibond wobble chairs. And I love these wobble chairs.
Patients love them too.
Yeah.
I mean, it feels really good. You wouldn't think, just a chair that you sit on and wobble, but powerful stuff.
It's beautiful spinal hygiene is what it is.
I like that.
Beautiful spinal hygiene. So you're sitting on this chair and you're moving your pelvis back and forth, interdependent of your lumbar spine, of your middle back, of your neck, of anywhere else. And it's the same thing. It's a similar action to what the intersegmental traction is doing. It's bringing blood flow to the area. With blood flow comes better oxygen, comes better nutrients, comes better healing. If you aren't moving,
There's no life.
You're dead.
Right.
Yeah.
Right. So imbibition is the word that actually creates. Yes, imbibition. So fresh blood, oxygen, nutrients in, and waste material out, and that's what's happening as you're doing wobble therapy throughout your spine. So that's one therapy. Cervical extension traction is another. Most of the time, patients come to us with very poor posture, forward head posture, leaning forward. We're in the year of texting and computers, and so we get this forward head, and we have to reverse that, because every inch forward that your head is, that's going to be an extra
10 pounds.
10 pounds sitting on your back. So no matter what you come in with, whether it's neck pain, back pain, we have to correct your entire posture in order to fix your problem ultimately. So cervical extension traction works on the ligaments of your cervical spine to bring your head back and work on getting that curve back in there. So it's a matter of sitting in a chair in extension for so many minutes and adding minutes each time you come.
Mm-hmm. If we can't stretch out the musculature, the ligaments, and the tendons in the front of your neck, because all day and every day, we're doing this, whether we're working, whether we're texting, whether we're cooking, whether we're doing dishes, I'm always kind of in this position. No, I'm not very tall either. Imagine what it's like for the very tall people, right? Mm-hmm. If we can't stretch these out, if these are super short, there's no way that I can expect you, or Dr. Nicole can expect you, to be in this good position and take pressure off that lower back, or take pressure off the neck, or the shoulders, or the middle back, or shoulder, whatever it is.
Yeah.
Right?
Yeah, and so it's interesting because the ligaments, they have three components. They're elastic, they're like a rubber band, right? They're viscous. They have like a watery component to it, and they also have a plastic component. So when you've been in this forward head posture for so long, take those three components into consideration and think about how the tissue is actually shortened, it's tight, but yet at the same time it does have the ability to reverse, and because of its elasticity it can change, and like Dr. Bryan said, it's malleable. So that is why we work with that, because it can be changed, and we do that.
Absolutely. One of the third things, or one of the other techniques that we utilize during the second phase of care, is our pre-core stretch machine. Now, probably of all the things that we do in here, the best feedback we get is on this pre-core stretch machine. Why? Because it's easy to do, it's active, it involves you stretching and moving yourself, and it's a machine where we can stretch the shoulders, we can stretch the middle part of that back, we can stretch the lower back, we can
hips,
stretch the glutes, the
hamstrings,
we can stretch
whole body.
Everything.
It's so cool.
Sorry. I was going to say, and oftentimes
we get so excited about this one.
I know, yeah. And patients really, really do love it.
Yeah.
They find that they haven't been able to stretch because they don't have space in their house, they don't have time in their schedule, they don't want to do it at the office because their coworkers are going to stare at them like they're aliens.
Yeah.
I don't know.
Crazy. The coolest thing about the pre-core stretch machine is that it enables you to get in positions to stretch that you can't really do on your own. So that's why it's like, well, can't I just do that at home? Well, do you have this unit at home that you can sit on and actually bend in the way in which it allows us to do that?
Without compromising that good spinal hygiene or spinal health, spinal stability, right? That's really all we care about. Good spinal health, good spinal stability. If you don't have spinal health, if you don't have spinal stability, it just branches out to other bad things happening.
Exactly. Now, something else that we might be doing in these two phases is decompression disc therapy. Some people come in with a disc injury, whether it's a bulging, herniated, prolapsed disc injury. And in that case, we have our go-to therapy, which I think it goes neck and neck with that pre-core as far as feedback from the patients.
Oh, yeah. Maybe even more.
Yes. So we can do this therapy on your cervical spine or your lumbar spine, so either area that's injured, and it's a specific table that you lay on, and if it's on the lumbar spine, there's a belt that wraps around the lower half of your body, another belt around the upper half of your body, and we put in your weight, and we can angle the table as such to, if we have an MRI, we can target a specific segment or segments, and it pulls apart and it goes through a pull pattern. Now, you're not pulling against it. It's not like physical therapy, like old school traction. It's not like that. It's very different. You're very relaxed. And because you're so relaxed and your tissue's relaxed, it pulls apart, and a vacuum effect is created within that injured disc site, and it allows the disc material to get sucked back in off the nerve. And we continue to do this usually through phase 1, phase 2, sometimes even phase 3, depending on the person's response. And it gets amazing results.
I can tell you firsthand that I had a back injury October of 2016. October of 2016. And since then, my back has hurt every single day. It got 90, 95, 96, 97% better with adjustments, but I was missing that last 2%. I could still exercise, I could still go about my day-to-day life. I was only in a little bit of pain, right? But I needed that last little bit to top off that glass, right? And decompression was it. I've been on decompression 2 or 3 times a week for the last couple months, and I'll tell you, I have no pain when I wake up in the morning. I have no pain bending over. I can exercise completely pain-free. It's going on with the adjustment, going on with the soft tissue work that Dr. Nicole does on my lower back. It's a cherry on top, right?
That's awesome. Yeah.
It's the icing on the cake that completes part of the package of what we can do to help.
We see that with lots of patients too. So, and you know what, maybe that's why our paths crossed. Maybe you like to perform at your best, if not even better than that. So, there's a reason for everything. So I'm glad that it's worked for you, honestly.
Me too, thank you.
Okay, so moving into the third phase of your care, we introduce a therapy called neuromuscular reeducation.
NMR.
NMR. So what this is about, most of the time when you come into us, you have these bad postural patterns that you have had for sometimes 1 year, 5 year, 10 year.
If you're 50 years old, you've had it for 49 years.
No telling, right? So one adjustment, one treatment is not going to fix that. 20 treatments is not necessarily going to fix that. But as we move into the third phase, what we find is if we work on exercises that involve using a vibration plate and have you do some general postural exercises on that vibration plate, we can rewire your nervous system and kind of reset it.
The one way that I explain this to patients is that vibration therapy is like your annoying little brother. We tell you to stand up on the machine, and we tell you to be in good posture, and we take you through these series of exercises. But this machine is shaking and vibrating. It's like your annoying little brother that keeps tapping you and telling you, hey, 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 I'm here. Hey, 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 I'm here. And your body likes to be in that position. It says, hey, I'm here, stay in this position. Hey, I'm here, stay in this position. So it's working on your nervous system. It's working on your muscles. It's working on your blood flow. And even some of our osteoporotic patients, it's working on your bone density.
Yeah, there's a lot of reasons why this piece of equipment is a very important part to our practice, and it's also important to complete your care and get to that phase so that you can make sure your results are more long-lasting, because that's what we want for you. We don't want you to have to need to see us at a high frequency forever and ever and ever. We want to be able to tweak your nervous system thereafter and keep you there and give you tune-ups, but we want to empower you and your body to just live this balanced life forever.
We do these 3 phases, or Dr. Nicole has implemented these 3 phases in her almost 20 years of practice based on the simple scientific method of this progressive overload, this progressively increasing frequency or decreasing frequency or increasing intensity, changing up load, changing up volume of what we're doing. And this is a tried and true way to get back in balance, get back in health. This is what all of athletics does. Athletic trainers, strength and conditioning coaches, top-level athletes, they use the same principle, progressive overload, to get better, to get healthier and to stay healthy. I think that's the most important part.
Yeah.
Is once you find that balance, stay in balance, because it's easier to stay in balance than it is to get back in balance. It's the same thing. It's easier to stay fit or stay more lean
than it is to start over
or
and over and over. Yeah.
Mine doesn't make that either.
Yeah, and I think also too, it's important to note that this regimen it's not written in stone for every single person. Everybody's different. We're working with different people, humans, with different problems and different muscles and different trigger points in their muscles in different positions. So we tweak things as we go. We alter things for each individual, and we have a general path or way that we're going to go about getting there, but it may be different for each and every person. Destination
is the same, but the journey is different.
Exactly. Oh, what kind of socks are you wearing
today? I have my baseball socks on. So I'm wearing baseball socks from the Yankees 1920s. Nice. I think it's Lou Gehrig. I don't.
Okay.
I think it is.
You like them?
But it's
I like them.
1920s baseball. Good.
There you have it.
Good stuff.
Okay, so as always, we want to give you that one thing, the practical thing that you can work on regarding this topic, therapies, and what you can do on your own to help live a more balanced life on the go.
Mm-hmm. We want to give you that knowledge that you can help yourself succeed, that you can get yourself out of pain. So the one thing that we want to give you is we want to have you take a self-assessment. Look at your posture. Look at your posture at work. Are you slouched over your computer? Are you slouched over sitting in your chair at the meeting, pretending to pay attention, right? Look at your posture at home. Are you slouched on the couch?
Do you have 5 pillows propping your head up while you're watching TV on bed?
Are you slouching over washing your dishes or slouching over while eating? All these things build up over time. We can help you when you're here, but we only see you for 10, 15, 20, 25 minutes. You go to work 40 hours a week. You go home the rest of the time. We only see you a little bit. So you taking some of these action steps to make sure that your posture is better can really help and increase your well-being and increase your balance.
Exactly. Whether you're a patient of ours or not, assessing your posture, making changes, and switching the way that you're sitting is going to really help the overall health of your body in the long run.
And as we say this, I'm sure 98% of you did the same thing. You groan, you go, ugh, I know my posture's bad. I know I need to do this. But so this is your reminder.
Exactly. And that's what we're here for. We just want to push you a little bit each time to be healthier, be better, and live that balanced life on the go.
Absolutely.
All right. That's a wrap for podcast number 3. Thanks for listening.
Appreciate it.